Vulnerable children wait almost 3 years to access mental health care, while others are seen in just a week. This is the attention-grabbing and slightly sobering headline that I read in the newspapers as I was doing my morning trawl to see what was out there. And this is discussing the apparent postcode lottery that exists in child and adolescent mental health services across the country, which sees some children and young people waiting a week after a referral for interventional services, and others waiting 3 years, depending on where they live in the country. And that is undoubtedly a scandal, undoubtedly scandalous. Having to wait 3 years for support with your mental health when you're ill, it can't be acceptable. However, there's something else within this headline that's really grabbed my thought process, and that is, what are we doing in society that is creating such a gigantic demand on mental health services for children and young people? So the article goes on, and it says over multiple lockdowns in the last 2 years, which has kept children away from school, their friends, their hobbies, 1 in 6 children has reported a mental health disorder in 2020 and 2021. Now, this statistic would appear to show an increase as a result of the pandemic, but I think it's really important here that we don't get too drawn into the narrative that the pandemic itself is driving this problem. These headlines have been around for years. Certainly I've posted headlines like this pre-pandemic, and I've been talking in schools for 3 years before the lockdown occurred. So we know that children and adolescent mental health services were struggling with demand back then. And I don't think it's just a finance issue either. That's an easy argument to have. And it's, I'm not saying it's not valid, that it doesn't belong in the discussion. But it's not where I want to focus my discussion, because what I'm concerned with is less about how we fix kids when the problems occur, and more about how society is structured that children are becoming ill in the first place. So I accept and acknowledge that within poor mental health, there will be an element of that that is probably largely genetically led, or responding to life events, etc., that would be largely unavoidable. But within the bigger picture, there is undoubtedly an aspect that is driven by our environment, by the social environment that we create. And I just look at that in terms of how much pressure young people are under and what we're doing to alleviate that. So one of the areas that I've just picked up on, because I think this is a debate that could go on for ad infinitum, and there's lots of examples we could bring, but just one example, a book that I've read, Why We Sleep, by Matthew Walker. So Matthew Walker is probably the most authoritative scientist on sleep globally. Well published, quite apart from his book, he's written a number of papers. And he says in his book that the adolescent circadian rhythm shifts in the teenage years. So when we're asking our teenage sons and daughters to go to bed and fall asleep at 10 o'clock at night because they have to be at 7 o'clock in the morning, that is the equivalent of asking ourselves to go to bed at 7 or 8 p.m. because their circadian rhythm has shifted. It's a natural process that's part of human evolution. The exact mechanisms and reasons aren't understood, but it has been demonstrated that teenagers shift their circadian rhythm and become sleepier later at night, which then means that they're not ready to get up in the morning because they haven't had sufficient sleep, because they haven't fallen asleep until later on. So he goes on to say that expecting them to wake up at 7 in the morning and function with intellect, grace and good mood is the equivalent of asking us to do that at 4 or 5 in the morning. Now, some of you who are early risers might say, yeah, well, I can get up at 4 or 5 and be civil. I can't. You know, that's not how my body clock works. And so I look at the way we've structured society and I think, who does it serve to have children going to school at 9 o'clock in the morning and having to get out of bed at 7 in the morning? Who does that serve? Does that serve them? Or does that serve the wider community, the wider society? And I think if we weren't facing this crisis in mental health, it would be easy enough to say, well, it meets the better needs of society, meets the wider needs of society, that we structure the day like this. But with this expanding awareness of the mental health of our nation and global mental health and the problem that it's becoming, I think we do have to start looking at things like this. Because guess what? These children and young people won't remain children and young people forever. What will happen is they'll become adults. And these problems that have been unaddressed in childhood will follow them into adulthood. And where they'll impact, well, they'll impact right across society, but they'll impact in the workplace as well. And they'll form part of that statistic of 105 billion, which is what it costs the UK economy, roughly, every year to manage poor mental health in our society. So I think there's more that we need to be doing as a society and as communities in thinking not just about how we repair poor mental health and not just becoming outraged when we see headlines that say we can't access remedial services, but looking at the bigger picture and starting to challenge some of these things that we just take as read, but that actually harming our mental health.